Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Multiple sclerosis, we are looking at the revised McDonald's diagnostic criteria. So this is as per the 2017. So the first one will be the clinical attacks. So first column will be the clinical attacks. So the first one we are dealing with is 2 or more, in terms of it is 2 or more. So the objective lesions, this includes 2 or more. So what will be the objective lesions? So objective lesions again will be 2 or more, greater than 2. So what are the additional requirements to make? This will be none. The next will be in terms of 2 or more. In terms of 2 or more, and the objective lesions being 1, and here the additional requirement will be none. Next again will be 2 or more, and here the objective lesion will be 1, and then the additional requirement to make the diagnosis will be the dissemination in space. So there is a dissemination. There is dissemination, and this is seen in space. Dissemination in space and demonstrated. So dissemination in space, and this is demonstrated by a clinical attack. So it is demonstrated by clinical. So this demonstration by the clinical attack implicating a different CNS site. So it implicates a different CNS site by the MRI. Next is we look at 1. So clinical attack will be 1. So in terms of the clinical attack 1 and the objective lesions being 2 or more. So this will be the clinical attack, this will be the objective lesions. So clinical attack 1, the objective lesions is 2 or more. So here the additional requirements to make the diagnosis would include the dissemination. So this includes the dissemination in time. So dissemination in the time, and it is demonstrated by the additional clinical attacks of the MRI. So additional clinical attacks of the MRI, or there is a demonstration of the CSF specific oligoclonal, or it is demonstrated by the CSF specific oligoclonal bands. Next is the clinical attacks 1. So this clinical attack 1 and the objective lesion 1. So here there is a dissemination in the space demonstrated by the additional clinical attack. So there is a dissemination of the space by the additional clinical attack. So there is additional clinical attack implicating a different CNS site or by the MRI. So it indicates a different CNS site or by the MRI. And so there is another criteria, that is and the dissemination in time demonstrated by the additional clinical attack. So there is the dissemination in time demonstrated by the additional clinical attack. So there is an additional clinical attack by the MRI. So it is by the MRI or demonstrated by the CSF specific oligoclonal bands, by the CSF specific oligoclonal bands. So other important thing is that there is no presence of additional test. So there is no additional test which is required, and the MRI is considered in all cases the spinal MRI or the CSF examination in patients with insufficient clinical diagnosis. So if it is insufficient, we go for the spinal cord MRI or the CSF examination. Spinal cord MRI. So we do for the spinal cord MRI as well as the CSF examination is what is done. Next we move on to the definition of the MRI evidence of the dissemination in space. So what is the definition of MRI? Evidence in terms of dissemination in space. So this means that there is a T2 lesion. So there is a presence of the T2 lesion in at least 2 of the 4. So T2 lesion is present in 2 of the 4. 2 of the 4 MS typical lesions. MS typical lesions. And what do you mean by MS typical lesions? It includes the periventricular. So periventricular, then also the juxtacortical. So peritubercular, juxtacortical, as well as infratentorial or the spinal cord. Next is other thing to note is the GD enhancing lesions are not required. So GD enhancing lesions are not required. Now let's look at the definition of the MRI evidence of the dissemination in time. So here the definition of the MRI with the dissemination of time. for the evidence of dissemination in time. The first one is DIS, there is a dissemination in the space. So in dissemination in time, there is the simultaneous presence of the GD. GD is nothing but the gadolinium. So there is simultaneous presence of the GD, that is a gadolinium, enhancing and the non-enhancing in a region. So there is a enhancing. So enhancing as well as a non-enhancing. So enhancing as well as a non-enhancing MRI lesions at any time. Next is there is a new T2. There is presence of the new T2 or the GD enhancing lesions. So there is new T2 or the GD enhancing lesions. And this is on the follow-up MRI. This is based on the follow-up of the MRI. To learn and grow daily like this, please do subscribe.